What's up, you guys? Welcome back to the Melanin and Med channel. So happy that you guys are here. For those of you guys that are new here, my name is Morgan. I am a second year medical student in New York City. My medical school curriculum is a little bit different. So we have an accelerated preclinical curriculum, it's like accelerated in the classroom. So we get started on the wards doing our clinical rotations during our second year at the beginning of that, whereas most students will do it in the middle of their second year or at the beginning of their third year. So my goal for my second year of medical school is just kind of like give you guys a little bit of behind the scenes action into what life is like on clinical rotations. And so for every rotation, my goal is to share a week in the life vlog. I've already shared that for my first rotation, which was surgery. And then now, after I finish every rotation, I wanted to share like a rotation recap. So welcome to my surgery rotation recap. A lot of medical schools will just have like a general surgery rotation. It kind of just depends on what medical school you're at, what hospitals they're partnered with, or where you're doing your rotations. Our school kind of offers a variety of options for surgery. I don't know if all of them would be considered general surgery. So my layout was 2 weeks of an outpatient focused service. So I was like 3 days in the OR, 2 days in the OR, and then like 3 days in clinic. So that was breast surgery. And then I had a 2-week surgery related elective, which I chose emergency medicine. And then I finished up on my inpatient rotation for 4 weeks, which was colorectal surgery. And so colorectal surgery, that was more of like what you would anticipate for your traditional general surgery rotation. So that's kind of like a lot of the tips that I'm going to share for this video is going to be more focused on that. So the first thing I want to share is just a little bit about like what my schedule looks like when I was on my surgery rotation. Honestly, it's different. I'm not going to share a lot about outpatient because I don't know how many people have experience with like outpatient surgery or like wound care, that kind of like same day surgery, that kind of thing. But I'm going to focus on my inpatient rotation. Just make sure to check out the vlog so that way you can see like a full week in the life. Usually it was wake up at 5 a.m. I would get ready, I would eat breakfast, and then I would walk over to the hospital. Rounds started at 6 a.m. So we would do sign out with the night shift. So the PAs are the ones that kind of like staff the hospital. Or staff like the floors while the attending are mostly like doing the procedures and the surgeries in the OR. So we did sign out at 6, and then after sign out was over, which would take like 10 minutes, we would split. For colorectal surgery, we had like an IBD side or non-IBD side, so we would split and we would go round until about 7:15, 7:30. Once we finished rounding, the first case usually started at 7:30 or 8, and so I would put my hair up in my nice little satin-lined scrub cap, head down to the OR floor, and then I would go and introduce myself to my first patient of the day, and then we would go into the OR and do like the cases. So cases really ranged from anywhere to like an EUA, which is an exam under anesthesia, which could be anywhere from like literally like 5 minutes to, you know, maybe an hour, all the way to like a J pouch redo, which could be 5-6 hours. And we had like some really complex ones, or we also have like joint cases with gyne and urology and different things like that. But pretty much I would just be in the OR until I was done. My day usually ended at like 6. That was usually when we were dismissed, but sometimes we had conference in the afternoons that we would have to stay for. Other times, you know, cases would run over, but if we finished before 6 o'clock, then we would head back upstairs, like the floor where most of the colorectal patients are on, and then I would just like check with the PAs and see if there was anything that I could do for them. So like I was able to help with putting an NG tube in, help our patients walk on the floor because walking really helps with bowel function post-surgery, different things like that. I would also like, if there was nothing for me to do, I would just sit there and like start doing my Anki and my U-World. So then I would like head home about, I would say 6:30, get home. I usually would eat, shower, and then after I showered, I would get in bed and I would finish my Anki and U-World. A lot of times, like, there's like a 30-minute turnover between, like, if you're with one doctor all day, then they have to clean the room for every case because you're usually in the same room for all the cases. So There would be like 30 minutes in between. So for some of those breaks, I would go grab a snack. I'd always go in and introduce myself to the next patient. But if I had any extra time, I would like try to do my UWorld, my Anki on my phone. So a lot of times I was done with that by the time I got home. And so really it was just like looking up one of the patients that I operated on that day, just to prepare a presentation to present on rounds the next morning, and preparing for the next day's cases, which we'll go into a little bit later. So I usually try to be in bed by 9, so I could go to bed by 10 and still get like 7 hours of sleep. And I feel like most days I was able to do that. Like the only times I didn't really do that, I feel like I was hanging out with friends or something, so it wasn't like because of surgery, it was just because I was stupid and I didn't want to go to bed early. So yeah, that's what like a typical day looks like on surgery rotation. How I studied for the shelf exam, there are about 1,290 Anki cards in the Anking deck. When you look at the Anking deck, you can kind of like filter by tag, and so I looked at step 2, and then I looked at surgery, I looked at shelf exams, and then I looked at surgery, and then there's like a no duplicates option, and then there's like an only step 2 cards. That kind of gets rid of like all the like step 1 content, which I got rid of because I'd taken step 1 beforehand. So there were about 1,290 Anki cards, and so we had 8 weeks, so I just like did, okay, 1,290 Anki cards divided by however many days that was, like how many cards do I have to do every day. And I think it came out to be like 32 or something like that. So my goal was to do 32 new cards, and then of course all of my like do or review cards. But like I said, like my first 4 weeks when I was on breast surgery, and then when I was on EM, it was a lot chiller, so I had a lot more time. So then by the time I started my colorectal service rotation, I only had to do like 15 new Anki cards a day because I had like kind of front loaded, so that worked out. And so I think I finished like my all the Anki cards 2 weeks in advance of my shelf exam, and so I just kind of kept doing all of the review Anki cards for that. And then in terms of UWorld, our school provides Amboss for us, and then we did like a class discount for UWorld. I loved UWorld for step 1, and I just realized like with dedicated there's not enough time to go through all the cards, so I just preferred to go ahead and start doing UWorld now during rotations, and then I can like reset it whenever I start studying for step 2 or something like that. So there were about 700 cards, so I just did by there's a shelf exam option, and then there's also a step 2 option. So make sure you're looking at shelf exam, and then I would do surgery, and then I would just, at the beginning of my rotation, I would kind of like go by subtopic. So like at the very beginning, when I was on breast surgery, I was like, I want to have breast surgery down packed. So I did a lot of the breast surgery questions. And then when I was on EM, I did like a lot of the trauma questions. And then at the beginning colorectal, I kind of front loaded with a lot of the GI questions. But then kind of once like I got towards a week or so into colorectal, I just kind of started doing mixed blocks. So I was getting familiar with everything. And what did I do? Yeah, I pretty much just like did it very slowly. I did all of the UWorld questions on tutor mode, so I was like reading the answer explanation. I would add stuff, like I used a notebook feature on UWorld, so I would have a lot of the tables organized by system, and a notebook option, so whenever I need to refer to something really quickly, I could do that. I think with surgery, I was just like so exhausted, I wasn't able to make any like study guides or flowcharts or anything like that, so I think I plan to do that for my other rotations. But just like reading over the answer explanations, a lot of the concepts come up over and over again. Like they want you to understand like when someone has blunt abdominal trauma, what do you do if they're hemodynamically stable versus not hemodynamically stable, or someone with penetrating trauma, in those same 2 categories. And so a lot of the concepts are like reinforced over and over, so I just kind of learned through that. And then I finished UWorld like maybe 2 days before my shelf exam. The weekend before my shelf exam was on a Friday, so like on Saturday I took one of the NBME practice exams. So I took NBME 8 for surgery, which is the most recent one. They're like $20 online. And I got a 68% on that. At my school, 54% is passing. And also our shelf exam only counts for 10% of our grade, whereas our OSCE counts for 25%. So my focus was more on the OSCE rather than the shelf exam. But on other rotations, I don't know what it'll count for or what the passing percent will be, so I might like give a little more energy. But like with surgery, I was just like trying to keep my head above water. The week of my shelf exam, I watched the Emma Holiday video. I highly recommend watching the Emma Holiday video at the beginning of your rotation. It's basically what all of the Anking step 2 shelf exam cards are based off of, so I think if you watch that at the beginning, it'll provide a lot of context and like help it be a lot easier because like on rotations, it's not like, oh, you go to the classroom, you learn about this, and then you do Anki cards. It's like you just are doing these Anki cards, and a lot of times, like, unless you're on that rotation, unless you're like on trauma, then you don't understand all the trauma cards and different things like that. And there's no way that you can do, you know, breast surgery and GI surgery and vascular surgery and trauma, you know, like there's just no way that every school will be able to give you the opportunity. Definitely recommend watching the Emma Holiday video early on. Day before my shelf exam, I did NBME 7 and I got a 64% on that. I was honestly so tired, just like rushing, trying to get through it because we had to go to campus and we had to work like the morning of the shelf exam. And then that night I watched Dr. High Yield. His video was amazing. I just used like, what is the new like AI thing? I just used AI basically to, I copied the transcript of the YouTube video, put it in there, and then it was like, make a study guide on this because I'm someone that I need visuals. And the Emma Holiday video has visuals because there's a PowerPoint with it. Dr. High Yield, he's just like talking at you, and I was not going to remember any of that. I'm like, I need to be able to read something and like make it make sense. And so I just have like AI software and make me a little study guide so I could see basically everything that he was saying as I watched that video. Highly recommend watching that video. If you have time, watch it early on in your surgery rotation, then definitely watch it again like a day or two before your shelf exam, where there were definitely a couple questions where I was like, okay, great, he covered that, and so I was able to remember it. And then I took my actual shelf exam, and I'm not over elated with my score, but I passed. I got 69%, and it was my first shelf exam, so you know what, I'm content with it. So yeah, that is pretty much how I studied for my shelf exams, and I would recommend, you know, if you're an Anki person, get through the Anki. Definitely, you should have more than enough time to get through all of the UWorld if you plan it appropriately. I was doing like 20 UWorld questions a day during the week. But I would take Fridays off because we got off early on Fridays for didactics, so I wanted to have like the rest of my evening off. And then I would do like 40 questions on one of the weekend days. Like I would do 40 questions on Saturday and then give myself Sunday off. And then once again, front loaded during my first 4 weeks. So then when I was on colorectal, I was only having to do like 10 questions a day, and it was beautiful. If you have more time to do more questions, then you can always go back and like do your missed questions. I would recommend that as well, just to make sure you're actually learning and retaining what you've been doing the whole time. My top 3 tips for general surgery rotation. Overall, I got really great feedback from the clerkship director, who was also a colorectal surgeon, basically saying like my plans were really good. I was always well prepared for my cases and things like that. So I just wanted to share a little bit about how I prepared. I think the first thing that you should do is set expectations. So figure out who you're going to be working most closely with. Depends on like the hospital that you're working at. So for us, we're mostly working with the residents because the residents are the ones that we round with. And then in the OR, we're there with the residents and the fellows. And then in the OR, we're there with the resident, the fellow, and the attending, but like the attendings don't round with us. They kind of like round on the patients on their own time. And so I set expectations with our chief resident. And so this is just like, how many patients should I present on? When should I present? If we're running behind on rounds, do you still want me to present? What time should I arrive in the morning? What time can I leave? If I don't have anything else to do for the day, do you need to dismiss me? Can one of the PAs dismiss me? Can an attending dismiss me? Are there any other assignments that I need to do? Like I had to do an oral presentation. And then do I need to introduce myself to every patient? What time should I be in the OR? Do I need to pull my own gloves? Do I need to pull your gloves? Do I need to introduce myself to, like, just little things like that. So just that you have a baseline of what you need to do and like what they're expecting for you. And I think that's really important because you don't want to get to the end of the rotation. They're like, yeah, I wanted you to present every day. And you're like, well, you never communicated that. So that's why I didn't present. And so that was like an issue that I had because we switched chief residents, and our first chief resident was like, I only want you to present on the patients that you operated on. And then, so like there's 2 days where I had same day surgeries. I wasn't presenting on someone because I didn't have anybody that was on the floor that we were rounding on that I had operated on, versus our second chief resident was like, hey, I want you presenting every day. So I would just like pull a patient off the list and do that. So I think it's really important to set expectations. Residents, they're busy, they're exhausted, but they were medical students once, and they probably have had other medical students that they've worked with on your rotation or on other rotations. So like just chat with them, and I'm sure they'll be happy to help. And then also like if there are any goals that you want for the rotation, make sure to share those as well. Now we're getting to our surgery specific tips. So the number one thing I think is so important, know about your patient. Do not go into an OR and just be like, la-da-da-da, la-da-dee. Like, no, you're not going to be expected to know, like, hopefully, you shouldn't be expected to know, like, every single step of a procedure, because if you know every single step of a procedure and you can do it by yourself, like, why are you still in medical school? But I would just have, like, a little, in Epic, we have, like, sticky notes, so I would just make a sticky note for each of my patients the night before. And so what I would have is a one-liner. So, okay, this is a 25-year-old female. Do they have past medical history? Do they not have past medical history? Kind of will depend on the rotation. And then the procedure. So, okay, we're going to do a fistulotomy on this patient, plus or minus ceton. And then the reason for the surgery. So, okay, if they're getting a fistulotomy, that's to open up a fistula tract. So they have an anal fistula, and then kind of knowing the anatomy. So like for fistulas, there's like, it's called Goodsall's rule, which basically says like, based on if the fistula is like anterior or posterior to the anus, like where the tract should open up inside the anus. And so just knowing like that anatomy as well. And then you can always like, I love Amboss, and I love, let's see, some other apps that I was told to download for my surgery rotation. NCCN guidelines, which I think are some National Comprehensive Cancer Network. So since I was doing colorectal and breast surgery, which are like, a lot of the surgeries are because of cancer, that was really helpful to have. And then also there's an app called Touch Surgery. So that was also like, kind of goes through like different surgical cases, gave you like step-by-step of what was happening. So once again, I think it's definitely okay if you don't know like all of the details, and like you're not gonna remember everything, but it was so nice just to prep the night before, just have those 4 things: one-liner, procedure, reason for surgery, and then the anatomy of the surgery. And also any questions would just like in between cases, I could look at that and I would know what would be happening for our next case. Practice at home. We had so many different attendings on my surgery rotation, and some of the attendings were very chill and were like, I want you to do anything to like make the incision, put in the port sites, close the port sites, do this running subcuticular suture. And then other attendings like, or just like because of, you know, if there's a fellow or a chief resident, like they want to give them the opportunity to do things as well, or like running behind. And so it's just like more efficient if the resident or the fellow who's done this like a million times will just, you know, close the patient. And so not every day did I have the opportunity to like suture or knot tie and things like that, but you want to keep up those skills. So buy a suture kit. I'll have a link to one in the description. My favorite one. They're about $30, but they're a very good investment. And then you can like see if there's like a skills lab, or at the end of a case, if there's unopened sutures, you can ask the scrub if you can take them, and then you can just practice with that at home. But definitely practice suturing and knot tying, and just like see what they want you to do. So I think like the main things that I learned how to do before was instrument tie and two-handed tie, and then I taught myself one-handed tie, and then we learned running subcuticular suture, and then like an interrupted deep dermal stitch, and that was like pretty much what I needed to do. But definitely practice at home, because they will be able to know in the OR like if you're still able to do things and you're picking up. The last thing that I want to share is stay stocked. So you know, we love getting that Patagonia for medical school, and surgery rotation is the best time to put it to use. There's some beautiful pockets on the Patagonia, and on rounds, like, it's so quick. You know, we have like 20 patients that we needed a round on in like 40-50 minutes. So that's like about 2 minutes per patient. And if they just had surgery yesterday, or you know, they're going to have wound dressings that need to be changed. If they have a Foley, or need to look at the Foley. If there's an NG tube, the NG tube needs to be flushed. If they have drains in, you're going to need to strip the drains and things like that. So you will notice, just kind of like, you know, go on rounds the first day, observe what are they grabbing for and what can you do to make their life easier. So I'll have an Instagram video on this as well, but a couple things that I would always keep stocked was some gauze and paper tape. Those are going to be for wound dressings, and also like to put around the drains, suture removal kit, some Q-tips, and alcohol swabs. And then that was pretty much like the main things that we use. Like gauze and paper tape was like for almost every single patient, because they all have, they all just had surgery, so they all have incisions and different things like that we want to like change the dressing on to prevent, infection and things like that. But yeah, I would highly recommend, like, see what they're using on the first day. Go to the supply room. You should have access. If you don't have access to the supply room, ask the intern, because they're probably going to be the nicest to you. Just ask the intern if they can let you in the supply room. Like, keep your pockets stocked. A lot of the rooms also have this, but like, it's so much easier if you're standing at the foot of the bed. You see them go to look at that dressing. You open that gauze and you have it ready and waiting for them. They can just pick it up as they're putting on the gauze. Okay, you got your tape. You pull out the tape. You already have it cut, rather than like, oh, let me go shuffle in these cabinets, see what they have, that kind of thing. They will love you, and it will just make their life so much easier. And it also gives you an opportunity to like be involved, because as they see that you're doing that, maybe they'll let you change the dressing or strip the drain and things like that. So yeah, y'all, I'm out of breath. That was just so much. That was just like 20 minutes of me talking. But there's so much, like, rotations are so stressful, and so I knew I wanted to make this video because I wanted this to just be like available for everybody, just to like hopefully ease your concerns about the rotation and just like give you some finite tips and things that you can, or not finite, give you some, I really wanted to give you guys some concrete tips for things that you can do, just to kind of, study for your self-exam, and also just to look like a competent person on your surgery rotation. Once again, thanks for tuning in. My next rotation will be psychiatry, so be on the lookout for all the details about that. And in the meantime, make sure to subscribe and check out my other videos. Bye, guys.